Professor Arzu Irban. She's a world-renowned figure in the ozone treatment, and her specialty is in anesthesia and in this ozone treatment, which treats many of diseases related to the pain and also to the dermatology, cosmetology, a lot of applications in which she is expert, and she has 14 years and more of her experience with many patients. So we are extremely thankful to the professor that she took her time out and accepted our invitation. So Professor, welcome to Pakistan, and I would want the people to know if you can introduce yourself and your specialty as well.
First of all, I want to thank you for your nice invitation. It is my first time in Pakistan and I like it and I love it. I'm professor at anesthesiology. I'm also pain specialist. I'm the head of algology department in Istanbul. I'm also dean of the Health Science University, Faculty of Health Science. I'm dealing with ozone therapy for 14 years. It is a good opportunity for me to do the ozone treatments in Pakistan. I think you will get very big benefit from the ozone therapy for Pakistani patients.
Thank you so much, and I hope greatly that under your guidance and your supervision, inshallah, we will have many patients getting benefit from the ozone. So can you just tell us that how did you start this ozone therapy, because it is not something which we usually are doing in the hospitals, and it comes under alternative medicine. So what made you come towards this field, and how did you develop interest in ozone?
Actually, my ozone history is a little bit strange. My first patient was my daughter. When she was 3.5 years old, she had a lesion on her face. Actually, it is a contagious lesion. Whenever she touched the lesion and touched another part of the body, it spreads there. We went to dermatology. My friends told me that this is a molluscum contagiosum. This is a viral disease. And it is the only cure we can be treated is the cancer chemotherapeutic agents. They give us 5-fluorouracil, and we were spreading it over the lesion via brush. It caused a lot of pain, and whenever it touched the normal tissue, it caused damage to the normal tissue also. She was very young, she was 3 years old, that's why it caused a lot of pain. While she was sleeping, I was spreading over the lesions. We continued the treatment, but there is no benefits. All the lesions are same, even that become bigger. I said that it doesn't change. What we can do, they said that we can apply the cryoanalgesia and we can make the incision. She was a little girl, she will become a female, and how we can do with the scar tissues on the face. I started to search some kind of treatment, and one of my friends told me that there is ozonated olive oil, you can use it. I said that ozonated olive oil, how does it work? They told me that it will benefit, but if it doesn't benefit, it does not cause any hazard. And I started to use ozonated olive oil at that time. Within 5 or 7 days, all the lesions gone. I can't believe, what is this? What is ozone? And I started to search it, and then I did some research, and I visited one of my friends who did the ozone, and I started to use, and I saw the results. I'm the one of the biggest fan of the ozone therapy now, and my aim is trying to separate it all over the world. But whatever the treatment, whatever the drugs you use, you have to use in right condition, so you can get the results and it will be benefited for the patient.
Thank you so much, and a very interesting story which you told, that how did you come in towards ozone, and your first patient was your daughter.
Yes.
So this proves that you see it is effective, and here we have many cases in which patients, they are not willing for surgery, and especially in cases of disc herniations in the spine, lumbar region. So it's very common in Pakistan. especially in obese patients, and many patients, they are not willing for surgery. So do you think that in those cases, ozone has a role for relieving their pain and symptoms?
As you know, our population's life expectancy is increased. We are getting older populations, and with older populations, they have so many comorbidities. So even the neurosurgeons cannot perform the surgery. Old patients with so much comorbidities. You are from the International Radiological Society. So interventional treatments are very good options for this kind of patients, because most of the interventional treatments can be applied under the pseudo-analgesia. We don't need general anesthesia. And we can do so many interventional treatments with radiofrequency, laser, so many techniques, but they cost a lot of money. Even in Turkey, most of the patients unfortunately cannot afford this cost. But with ozone therapy, we can achieve very good results. We don't need so many tools. As you see, we did some operations today. Inshallah, you will see the results of this applications within 14 days. Ozone therapy is a good chance. We can apply under the pseudoanalgesia. We can apply many patients with comorbidities, and also in experienced hand with good tools like your operation theater. You have very good scope, you have very good table, and you have very talented personals. With this kind of good teamwork, we can get many good results, and patients get benefit from this.
So do you think, because ozone is something new to many doctors, so you see, we have some scientific evidence of its effectiveness, and have you published some papers or done some research regarding this?
After treating my daughter, I started to search what is ozone, and there are some echoes in the world, European echoes and Russian echoes. Russians had a lot of publications, but unfortunately most of the publication in Russian, so rest of the world does not use this. But nowadays, especially after the COVID, there are a lot of ozone publications. The only agent which is shown effective against the COVID is ozone therapy. You cannot believe, because ozone has antiviral effects. It can be also used antibacterial, antifungal, and antiviral effects. So if you check the PubMed, this is the publication of medical papers, you can see a lot of papers done with ozone therapy. Especially I did some experiments with spinal cord injury, which is the most of the big problems, because there are a lot of young boys, even in Pakistan, they have a lot of motorbikes driver. Oh my God, they are crazy. They may have accident, and they may have spinal cord injury, and we have very good results with spinal cord injury and femoral fracture. And even one of the most of the problem is the infertility, both female and male infertility. We have very good results with ozone therapy. I have doing research and publicate papers on these issues also. I can say that if you use in good and right indication, right doses, you may get very good results with ozone therapy.
So you just told us that you have papers regarding the ozone therapy. So how many papers you have written about the ozone therapy?
Unfortunately, I'm not counting them. I'm attending many congress. I am presenting my publications. I'm presenting my cases. Sometimes number is not important. Quality of the papers is also important. Quality of your results is important. I'm working in Istanbul. I'm working in Istanbul Health Science University. You cannot believe so many patients getting benefit from the treatment, like a gossip. spreading the other people, saying that ozone therapy is good, we get very good results, very good results. A lot of patients coming from United States, Canada, Kingdom of Saudi Arabia, Sudan, Ethiopia, England, from the Syria, you cannot believe. If your treatment is effective, patients are coming all over the world to get the shifa. It is very important.
So it's nice to hear that many patients are getting benefit, and now we have done cases here, so Pakistanis will be getting benefit soon, inshallah. And do you notice some side effects of this treatment? You have done so many cases of ozone, so have you noted some side effects of this therapy?
Actually, I believe that there is no side effect related to the ozone therapy. There is side effect or complications related to the physician's applications. I'm giving some courses to teach the doctors. I'm always saying that you have to be with your patients. For example, for intravenous treatments, we are taking patients' autolog blood, mixing with ozone, and transfuse to the patients. At the beginning of the course, I am asking the doctors, do you know how to open an IV line? They are saying that we don't need to open IV line. My nurse can do. I'm saying that no, you have to do. You have to learn how you can. Because if you don't know how to do, you cannot control your nurse. After a while, some of them saying that, oh, yeah, opening the IV line is easy, no need. Nurse can do. But sometimes they don't know the procedure, and they are calling me, oh doctor, I left the patient to the nurse and they give the ozone directly to the intravenously, and patient had air embolism. Now he can't breathe. He had hypotension, he had hypoxia. I'm saying that what I did before. This is a complication or this is a side effect, but actually this is a malpractice. You have to do, and you have to. Yeah. So, in my point of view, really there is no side effect or complication related to the directly to the ozone therapy. The only contraindication is I don't know if you have bakla in Pakistan. If any patient, when eat the bakla, had abdominal pain or cramps, we call it favism. It shows the deficiency of one enzyme, which is glucose 6-phosphate dehydrogenase enzyme. If there is deficiency of this enzyme, you cannot apply ozone therapy for these patients. This is the only contraindication which you cannot apply ozone therapy. Also, there are some relative contraindications like allergy, like pregnancy, like uncontrolled hypertension. But there is also any nuance here. As I said before, for reproductivity, for fertility, we are using ozone therapy for the woman and for the man. But ethically, it is not allowed to do any research for the pregnant woman. So we cannot apply ozone therapy during pregnancy. But we cannot apply the ozone therapy intravenously for systemic effect. I don't know if I can speak. During pregnancy, unfortunately, a lot of women had vaginal candidiasis because of the toilets, and most of the anti-candidiasis drugs cause liver failure. It increases the liver enzyme. It may cause hepatitis related things. Not hepatitis, hepatotoxicity. In this case, we can use the topical ozonated olive oil to treat this, and we can use the ozone to make them fertility, to make them pregnant. And for allergy cases, we can use the ozone to treat the allergy, to treat the asthma. But it says that in allergic condition, it is relatively contraindicated for intravenous injection.
So thank you, Dr. Arzu, for your very descriptive and your very detailed description about the ozone. And I'm also extremely thankful to the Medicare hospital administration, the cath lab staff, the cath lab manager who arranged all the things, the pharmacy who arranged all the required things in a very short notice of time, because we finalized we had very less time, and we had the patients who had disc herniations in the spine. They were not willing for the surgery, so we evaluated those patients in the Medicare OPD, and Dr. Arzu was kind enough. She herself reviewed all the cases and then approved for the treatment. And today, alhamdulillah, we did the ozone therapy for all of them, and we had no immediate complications in the Medicare General Hospital. We did them, and they all were discharged. And inshallah, we will see how the effects they have, and then we come back. And as you said, that it should be done in a right way, in a trained persons. So we hope that under your supervision and guidance, we'll be able to promote this ozone therapy in Pakistan, and patients will get a lot of benefit. So once again, thanks a lot for your coming to Pakistan and your contribution to this field. Thank you a lot.
Sir, one question. In future, if any patients from Karachi wants treatment, ozone treatment, will they visit?
The patients, if they want, they come. So I'll be doing OPD on Thursday after 5 to 6 in the Medicare General Hospital. So they can always come to me, and I can see, and then I can always take advice from the Professor Arzu as well regarding those cases which we want to do, and then we can select patients, and in those patients who are ideal for the treatment, so we can do it.